I just want to talk to you a little bit about lower back pain today. Okay, there's been a lot of research released recently that has shown that exercise in combination with education is the best way to treat lower back pain as opposed to medication. Okay, so I'm going to tell you some things you can do at home and things not to do. If you've either had lower back pain, it's good at preventing it. If you have it now, it could be useful at relieving it. And so I want you to think about your lower back like it's a bridge, okay? A nice, strong, steady bridge. On either side, you have another bridge, which is your upper body, and another bridge, which is your lower body. And the purpose of your lower back is to transfer traffic, in this case, force, from between both bridges, okay? So it disperses force from your upper body to your lower body and vice versa, okay? So if we have a bridge, we don't really want it to be flexible or bendy or anything, okay? So when people do stretches for their lower back, such as lying on the ground and twisting it like this, it might feel good at the time, you might get a few cracks, but actually it loosens up the lower back, makes it less stable. If it's less stable, it moves more. If it moves more, then there's more chance of it incurring an injury, okay? So instead of doing that, if you have a specific pain in your lower back, use a tennis ball, a trigger ball, a softball, just to trigger point it, and that can release the tension without compromising the integrity of your lower back. Okay, so there are three main causes of lower back pain: tight hips, all right, weak core, and weak glutes. Okay, so first we're going to address tight hips. So simple exercises you can do at home. If you have a bench or a chair, put your back foot on, knee on the ground, just push your hips forward, okay? You should feel a stretch here. This is really good because it stretches your hip flexors at your hip and also your quadriceps, okay? Another one you can do, free part mobility. Start like this, stretch the back of your legs, bring your foot forward, sink down, you should feel a stretch here. Standing back up, pushing hips forward, feel a stretch here, okay? So you repeat that on the other side. Do that a few times on each side. That one's really good because it stretches front, side, and back of your hips all in the one exercise. Okay? So let's think about that. You've got tight hips. The equivalent of that is the supports on the bridge are very tight, okay? So the bridge isn't level, it's kind of irregular on an angle, so obviously that is not what we want when we're trying to effectively, control traffic, control force, that kind of thing. Okay, so the second one is a weak core. So let's think of the core as the cables that are holding the bridge in place. If they're too weak, the bridge gets sloppy, moves too much, isn't steady, okay? So the best thing for a tight core is a plank, okay? Not just a regular plank, but you want to be tensing your core, your butt while you're doing it. So think about if someone was to punch you in the stomach, you kind of have that brace position, okay? When you do a plank, it's not about how long you can hold it, it's about how much tension you can produce. So you should be struggling, shaking after 10-20 seconds, okay? Third thing is weak glutes, okay? So let's say the glutes are the pillars that are holding the bridge up. Again, if they're weak, then the bridge is going to be unlevel and not as effective as it could be. So the best glute exercise that you can do at home is a simple bridge, okay? It suits the scenario here. So hold one knee to your chest. This locks out the lower back, stops it from moving. Foot nice and far away from your butt. Just going to lift your hips up and down, up and down. If your legs are too close in, uses your quads instead. That's not what we want, so make sure it's nice and far up. And then switch legs after you do turn on each side. And with any luck, that should improve your back pain. Thanks.